Okay, we're back and we're going to talk about Achilles tendon pain now. Just a little bit of a precursor to this. Historically, when we've talked about Achilles tendon pain, we've talked about Achilles tendonitis. We really don't tend to call it that anymore because Achilles tendonitis is a specific diagnosis. In other words, it means that we have inflammation of the Achilles tendon or the structure surrounding it. And the reason we don't call it that is that when we actually are able to look at this with biopsy, we don't see any of the normal mediators of inflammation, so we don't see any indication that there's actually inflammation occurring here. And the modern thought is that we're actually dealing more with a degenerative tendon disease, so tendinosis. And so we tend to call this condition now Achilles tendinopathy rather than Achilles tendonitis. It's just a point of order, but anytime you see itis after something like bronchitis, means inflammation of the bronchi and the lungs, it means it is inflamed. This condition is not inflammation, so we shouldn't call it that. Is it nitpicking? Well, not really, because if it was an inflammatory condition, we might treat it with steroids or we might treat it with anti-inflammatory medication, but of course that wouldn't work because it's not inflammation. So it gets back to how you treat the condition. All right, so what are we dealing with here? Of course, the Achilles tendon is the largest, strongest tendon in the body. It's a very, very important tendon. Tendons are the structure that distribute force from muscle to bone. So the Achilles tendon is the endpoint of the very powerful calf group. It attaches to the heel bone, the calcaneus, and it is responsible, it's the primary plantar flexing muscle of the body. As you can imagine, incredibly important in running sports because it allows you to push off. This muscle is very, very important. Obviously, if you've got a problem with the Achilles tendon, you can't do that. So for sport, any issue around this tendon is a big deal. The structure's not just the tendon, it has what's called a paratenon that surrounds it. It's a loose sheath that surrounds the tendon. Important to note that because that also can be part of the injury. There are two main forms of Achilles tendon injury. You can either have an injury to the tendon itself, the tendon proper, and as we've said, that's normally degenerative, which we call tendinosis, which means you get this kind of gnarly, gunky degeneration of the tendon. It looks pretty horrible when you look at it surgically. But it's a degenerative area within the tendon, tends to weaken the tendon somewhat, and that probably also is a source of pain as well. Another version of Achilles tendinopathy is insertional, so where the fibers actually insert into the heel bone, these can become damaged and inflamed, causing a problem called insertional Achilles tendinopathy. Not something I like to see. It's very difficult to shift. It tends to hang around, and it's really a difficult prognosis for the athlete. So what would we expect to see, and how would I examine this? Again, I'd be wanting to just have a look at the tendon, first of all in a relaxed state. I'd be carefully palpating the tendon itself to see whether there was pain over the tendon. I'd also be instituting some sliding maneuvers here just to see whether the tendon sheath or the paratenon was involved. I'd then want to put the Achilles tendon on stretch by dorsiflexing the foot, so the Achilles tendon is now loaded, and I'd be repeating that process. We've pretty much taken the paratenon out of the equation here now because it doesn't slide when the tendon is under load. So we now can do the same palpation around this tendon to establish whether it is the actual tendon itself that is part of the problem. Insertional Achilles tendinopathy is pretty straightforward. We can just palpate right over the area of pain, trying to localize it. This is often very, very localized pain. The pain is more common on the lateral aspect of the calcaneus than the medial aspect of the calcaneus, and that's just because of the way the tendon inserts in the bone. Sometimes you can have a thing called a retrocalcaneal bursa, which is a fluid-filled sac. This is often very involved with poor-fitting footwear. It can be quite a bulbous swelling around the heel. That's a different proposition, but it's all part of the structure around the Achilles tendon. Now, I'd also be wanting to have a look at the range of motion here. So while I had my patient in this prone position, I'd be wanting to make sure that they were able to achieve the normal range of dorsiflexion. I'd go through all of my normal biomechanical testing and try to figure out what I was dealing with here. Once again, muscle strength, muscle weakness, looking higher up the segment, looking at the proximal structures, also incredibly important. Gait analysis, certainly very important with Achilles tendinopathy. We're looking for things like an early heel lift, which might indicate that the calf complex, the triceps surae, is tight. always comparing one side to the other side. In terms of treatment, how would I deal with this? Basically for pain within the main body, the Achilles tendon, I'd be throwing everything bar the kitchen sink at this. So I'd be looking at icing, not for any anti-inflammatory component, because we've said it's not inflammation, but for the analgesic component of that. Analgesic medication can also be helpful. We tend to use as a mainstream treatment for this particular problem something called the heavy load eccentric muscle loading program, which simply means that you are eccentrically contracting the calf group, putting a very heavy eccentric load on the Achilles tendon, which stresses the tendon in a positive way and helps to realign the collagen fibers. That is meeting with global success, so people who are using this program are finding it extremely successful. The other thing that we need to consider here with insertional Achilles tendonitis, insertional Achilles tendinopathy, the heavy load program won't help that at all, so you shouldn't be using that in that particular area. I think it's very important to investigate this area properly, so you might be wanting to look at things like MRI or ultrasound. They're the two investigations that image this problem best. MRI will show you a beautiful imaging of the insertion. It will show where there's areas of fluid. I saw a really interesting one this week where the problem was not actually the insertion of the Achilles tendon, although everybody thought it was. It was actually the posterior subtalar joint, which was highly inflamed, and the pain was referring. So you just got to be aware of a few little things like that. How would we treat this? I think modern physiotherapy, massage therapy, these sorts of things are quite beneficial here. You might like to be looking at things like dry needling, might be quite useful. If it's insertional, you might like to consider ultrasound-guided infiltration of cortisone. The insertional form of Achilles tendinopathy often is inflammatory, as distinct from mid-substance. So that's a situation where an injection of cortisone may well work. Looking at muscle balance, muscle strength, also very, very important. If you've got any limitation in the calf joint, in the calf range of motion, if you're not able to achieve adequate dorsiflexion, then obviously that's got to be worked on. Stretching is often used as a treatment program here. It's very controversial. We're still not exactly sure of the exact benefits of stretching, but if you are going to do that, you need to make sure that you do stretching with the knee straight and also stretching with the knee bent, so that you get so that you're stretching gastrocnemius and also soleus. So when you're stretching soleus, the knee is straight. When you're stretching when you're stretching soleus, the knee is bent. When you're stretching gastrocs, the knee is straight. Biomechanical assessment, very, very important. We definitely want to be having a look to see what the foot is doing, and as I said, higher up the segment, also quite important. Okay, that's it in a nutshell. Have a think about those things. Very important condition. Can't stress rest enough. Make sure that the athlete understands that, and our next discussion is going to be on plantar heel pain.